We head into the winter months in a much stronger position than last year. Of all the reasons for this progress, the greatest is unquestionably our vaccination program. Across the UK, the overwhelming majority of us have made the positive choice to accept the offer of vaccines against COVID-19. Almost 8 in every 10 people over the age of 12 have chosen to be double jabbed, and over 10 million people have now received their boosters or third jabs. I'm grateful to colleagues across this House for their steadfast support of our national vaccination program. Despite the fantastic rates of uptake, we must all keep doing our bit to encourage eligible people to top up their defences and to protect themselves this winter. I understand that vaccination can, of course, be an emotive issue. Most of us have taken this step to protect ourselves, to protect our families, and to protect our country. We've all seen, sadly, how COVID can devastate lives. But we've also seen how jabs can save lives and keep people out of hospital. Our collective efforts have built a vast wall of defence for the British people, helping us to move towards the more normal way of life that we've all been longing for. The efforts of the British people have been phenomenal, and those working in health and social care have been the very best of us. Not only have they saved lives and kept people safe through their incredible work, but they've done the same by choosing to get vaccinated. And I want to thank NHS trusts and primary care networks for all the support and the encouragement that they have given their staff to take up the vaccine. The latest figures show that 90% of NHS staff have received at least 2 doses of the COVID-19 vaccine, although in some trusts, the figure is closer to 80%. But, Mr. Deputy Speaker, while our health and social care colleagues are a cross-section of the nation at large, there is no denying that they carry a unique responsibility. They have this responsibility because they are in close contact with some of the most vulnerable people in our society, people that we know that are more likely to suffer serious health consequences if they get COVID-19. So whether it's in our care homes or in our hospitals or any other health or care setting, the first duty of everyone working in health and social care is to avoid preventable harm to the people that they care for. And not only that, they have a responsibility to do all they can to keep each other safe. These twin responsibilities to patients and to each other, they underline once again why a job in health or care is a job like no other. So it cannot be business as usual when it comes to vaccination. It's why, from the very beginning of our national vaccination program, we put health and care colleagues at the front of the line for COVID jabs. And it's why we've run 2 consultations exploring some of the other things that we might need to do. Mr. Deputy Speaker, the first consultation that looked at whether we should require people working in care homes to be vaccinated, what's called the condition of deployment. After careful consideration, we made vaccination against COVID-19 a condition for deployment in care homes from the 11th of November. Since we announced this in Parliament, the number of people working in care homes who have not had at least 1 dose has fallen from 88,000 to just 32,000 at the start of last month. Our second consultation looked at whether we should extend this requirement to health and other social care settings, including in NHS hospitals and independent healthcare providers. Our 6-week consultation received over 34,000 responses and, of course, a broad range of views. Support for making vaccination a condition of deployment was tempered with concerns that some people may choose to leave their posts if we went ahead with this. I've carefully considered the responses and the evidence, and I've concluded that the scales clearly tip to one side. The weight of the data shows our vaccinations have kept people safe and they have saved lives, and that this is especially true for vulnerable people in health and care settings. And I'm mindful not only of our need to protect human life, but our imperative to protect the NHS and those services upon which we all rely. Having considered the consultation responses, the advice of my officials and NHS leaders, including the Chief Executive of the NHS, I have concluded that all those working in the NHS and social care will have to be vaccinated. We must avoid preventable harm and protect patients in the NHS, protect colleagues in the NHS, and of course, protect the NHS itself. Only those colleagues who can show that they are fully vaccinated against COVID-19 can be employed or engaged in those settings. There will be two key exemptions. One for those who don't have face-to-face contact with patients, and the second for those that are medically exempt. These requirements will apply across health and wider social care settings that are regulated by the Care Quality Commission. Mr. Deputy Speaker, we're not the only country in the world that has taken such steps. There are similar policies for specific workers in other countries, including the United States, France, and Italy. We also consulted on flu vaccines, but having considered views that we should focus on COVID-19, we will not be introducing any requirements on flu jabs at this stage, but we will keep this under review. And of course, Mr. Deputy Speaker, these decisions are not mine alone. As with any other nationally significant COVID legislation, Parliament will have its say, and we intend to publish an impact assessment before any vote. We plan to implement this policy through powers in the 2008 Health and Social Care Act, which requires registered persons to ensure the provision of safe care and treatment. And I will shortly bring forward a draft statutory instrument amending these regulations before the House, just as we did with care homes. Mr. Deputy Speaker, this decision doesn't mean that I don't recognise concerns about workforce pressures this winter and indeed beyond. As a result of some people perhaps choosing to leave their job because of the decision that we've taken. Of course, I recognise that. It's with this in mind that we've chosen for the condition not to come into force until 12 weeks after parliamentary approval, allowing time for remaining colleagues to make the positive choice to protect themselves and those around them, and time for workforce planning. Subject to parliamentary approval, we intend the enforcement of this condition to start on the 1st of April, and we will continue to work closely across the NHS to manage workforce pressures. More than that, Mr. Deputy Speaker, we'll continue to support and encourage those yet to get the vaccines to do so. At every point in our programme, we've made jabs easily accessible and worked with all communities to build trust and to boost uptake. And that vital work will continue, including engagement with communities where uptake is the lowest and one-to-one conversations with all unvaccinated staff in the NHS, and using the capacity of our national vaccination programme with walk-in centres and pop-up centres, all making it as easy as possible to get the jab. And Mr. Deputy Speaker, allow me to be clear that no one in the NHS or care that is currently unvaccinated should be scapegoated, singled out, or shamed. That would be totally unacceptable. This is about supporting them to make a positive choice, to protect vulnerable people, to protect their colleagues, and of course, to protect themselves. The Chief Executive of the NHS will write to all NHS trusts today to underline just how vital these vaccination efforts are. Mr. Deputy Speaker, I'm sure that the whole House will want to join me in paying tribute to the heroic responses across health and care. They have been the very best of us in the most difficult of days. Care and compassion and conscience continue to be their watchwords, and I know that they will want to do the right thing. Today's decision is about doing right by them and doing right by everyone who uses the NHS. So we protect patients in the NHS, we protect colleagues in the NHS, and we protect the NHS itself. I commend this statement to the House.
Shadow Secretary of State, Jonathan Ashworth.
Thank you, Mr. Deputy Speaker, and I thank the Secretary of State, as always, for a timely advance site of the statement. Vaccination saves lives. It's the best protection against this deadly disease and helps cut transmission. And we, of course, want to see NHS staff vaccinated. And as has been pointed out many times before, there are already categories of staff for which a hepatitis vaccination is expected. So we will look carefully at the regulations and the equality impact assessment, but I would urge the Secretary of State to proceed with caution, because we know the NHS is under the most intense pressure this winter already. We know that waiting lists are at close to 6 million, and we know there are over 90,000 vacancies across the NHS, and we know that the Chancellor failed to allocate funding for training budgets to train the medics that we need for the future in his budget the other week. So there will be anxiety at trust level that a policy, however laudable in principle, could exacerbate some of these chronic understaffing problems. We simply not afford to lose thousands of NHS staff overnight. On saying that, we do welcome that the Secretary of State has listened to representations from organisations like NHS providers and others about delaying the implementation of this until after the winter. We welcome that. But nonetheless, there are still organisations like the BMA who have raised concerns about the practicalities of implementing this policy. Helen Stokes-Lampard of the Academy of Medical Royal Colleges has said mandatory vaccination is neither necessary or proportionate. So will he agree to meet with Royal Colleges, the BMA, the relevant trade unions to agree a framework for how this policy will be implemented? And can he outline to the House what he considers would be outline what success looks like for this policy? Because of the 10% of NHS staff who are not vaccinated, some of that includes those with medical exemptions, some of that includes those who are on long-term sick, some of them includes those who couldn't get the vaccine first time round because they were ill with COVID. So could he tell the House what is the actual number of NHS staff who should be vaccinated but haven't had the vaccine? What is the actual number? And in other words, therefore, what then does he consider success? What does full vaccination look like for him? Is it across the NHS? Is it 94%? Is it 95%? Is it 96%? What is it we are aiming for here? What is his target? Secondly, the aim of this policy is presumably to limit those with COVID coming into contact with patients. But one can still catch and transmit COVID post-vaccine. So will the testing regime that is in place for NHS staff, I think it's twice a week at the moment, will that increase in frequency? And of course, across the whole of the NHS estate, thousands of visitors go into the NHS estate every week. So will visitors to hospitals be asked to have had the vaccine or have proof of a negative test? And thirdly, what analysis has he done of those who are vaccine hesitant in the NHS workforce? And what targeted support has he put in place to persuade take-up amongst those groups? He refers to trusts where there's around 80% take-up. So what specific support has he put in place to help those trusts drive up vaccination rates? And we know from society more generally, there has been hesitancy, for example, amongst women who are pregnant who want to have a baby. And this has meant a significant proportion of those in hospital with COVID are unvaccinated pregnant women. Large proportion, obviously, of the NHS staff workforce are women of a similar age. So is this one of the issues as to why there is hesitancy in certain pockets across the NHS? And will he therefore look at a large-scale campaign to reassure pregnant women of the safety of the vaccine and look at launching an information hub, perhaps a dedicated phone line to offer clear advice to women and their partners who might have concerns? And finally, on vaccination more generally, I don't think anyone across this House wants to see any more lockdowns imposed on cities like my own in Leicester, like we had, or across Greater Manchester or Bradford. But in many of these areas, vaccination rates are not good enough. Leicester has a vaccination rate of just around 61%, Bradford 63%, Bolton 69%, Bury 71%. Generally on children's vaccination, we're only at 28% amongst children's vaccinations. And on the boosters, there are still around 6 million people eligible for a booster who've not yet had one. And the government's own analysis shows that people over 70 who are dying from COVID or hospitalised should have had a booster, but have only had 2 jabs. So with Christmas coming, which will mean more mixing indoors, at a time when infection rates are still high, 1 in 50, We are facing six crucial weeks. So what more support will he offer local communities now, like Leicester, like Bolton, like Bury, like Bradford, to drive up vaccination rates, because nobody wants to see those local lockdowns again?
Your state.
Mr. Deputy Speaker, I mean, first of all, can I thank the right honourable gentleman for his approach to this and issues around vaccination in general. There's no doubt that the general consensus in this House across parties has played a vital role in building confidence amongst our citizens in vaccines. And once again, I thank him and his party for their approach to vaccination. And he's raised a number of questions. He suggested caution in this approach, and he's right to suggest that. And I hope from what I've already shared with the House today, but will of course continue to share, that he will feel that we are taking a cautious approach. So, for example, the grace period after Parliament votes, if Parliament supports this move, that there'll be a grace period so that those in the NHS and social care that have not yet chosen to take any vaccine, that they will have plenty of time to do so. He's asked about meeting with healthcare leaders. Of course, he won't be surprised that I, probably like him, I meet with healthcare leaders all the time and would continue to do that, and I'm more than ready to listen to them even further, more than the consultation that we've done so far on this, about what further suggestions they would have, especially around implementation and take-up. He asked me, the right honourable gentleman, specifically about the NHS take-up. The take-up throughout the NHS in England is 93% of the first dose, 90% of 2 doses, and that does leave, I think, around the latest number I have is, I think, 103,000 people in the NHS that work for the NHS that are yet unvaccinated, so not even one jab. And I think here the right honourable gentleman will understand it's hard to know what portion of that number will take up the offer of vaccination. If we look at the what's happened with social care homes, and since that policy was announced, there was a significant fall in the equivalent number, and I think we can certainly expect that here. But as he has suggested, and as came through very clearly to the consultation, it is about making sure that people are encouraged to take a positive choice. And what I said earlier, Mr. Deputy Speaker, it can't be clearer. No one should scapegoat or single out anyone in the NHS or social care that has, for whatever reason that they may have, at this point chosen not to get vaccinated. This is all about working with them positively, making sure that they have information that they need. And to answer his question further, what more will be done in making that, helping people to make that positive choice, as well as information. One-to-one meetings will be offered with everyone that is unvaccinated. If that's what they want, they will have the opportunity to meet clinicians and others to allay any concerns they might have, including, of course, anyone that is pregnant or thinking of maybe one day becoming pregnant. He's right to raise that too. And then lastly, on the vaccination program overall, I think the right honourable gentleman will agree, as a country, we have done remarkably well. Almost 8 out of 10 people over the age of 12 double vaccinated. That is one of the best vaccination rates in the world. But as he has said, and others have said, we still need to be working harder to do better. There are still too many people that haven't taken up an original offer of the vaccine, and we need to make sure that those that are eligible, that should get their booster shots, that it's made as easy as possible for them. And some of the recent changes, for example, to the booster booking system, has led to a phenomenal increase in booster shots, over 10 million throughout the UK, a number that's growing all the time.
Jeremy Hunt.
Thank you, Mr. Deputy Speaker. This is a difficult decision, but the right decision. And I congratulate the Health Secretary for biting the bullet on this. And I congratulate his predecessor for laying the foundations of the vaccination programme that's made it possible. When you have a disease which can be transmitted asymptomatically, all of us have a responsibility to protect the most vulnerable people. No one more so than doctors and nurses. I don't know a single doctor or nurse that wouldn't want to be double or triple jabbed in order to make sure they're protecting their own patients. And reducing the number of nosocomial infections is one of the big learning points from this pandemic going forward. So it's the right thing to do. But exactly the same arguments for the COVID vaccine apply to the flu vaccine. And I note today that the Health Secretary has not made an announcement about the flu vaccine. Could I encourage him to do so? Because I wanted to vaccinate NHS staff for flu much more comprehensively than was happening. I think my successor wanted to do it as well. And I think this is something that needs to happen for exactly the same reasons. There is asymptomatic transmission of flu, just as there is asymptomatic transmission of COVID. So I'd encourage him to look at that, and I'd be interested to hear what his plans are on that front.
Secretary of State.
First of all, can I thank my right honourable friend for his support for today's announcement? And I know he speaks with huge experience, and I know that he is rightly focused for years on the importance of patient safety, and I know he will also welcome this as a patient safety measure. On his particular question around flu, we did consider that carefully. As he knows, we did consult on it. We looked at the response to the consultation, and after consideration, we were not convinced that we should go ahead with flu at this stage, but the option remains open.
Tony Lloyd.
Thank you, Mr. Deputy Speaker. The Secretary of State, I think I'm guardedly sympathetic to the direction of travel that is going in, but obviously one of the things that can occur is that this could lead to specific skill shortages in different parts of the health service. Can you give a guarantee that this will be monitored, and it will be monitored at a granular level, so we can be certain that, well, for each honourable member, we're not finding it's our own hospitals that develop those skill shortages in absolutely vital services?
Secretary of State.
Of course, Mr. Deputy Speaker, the honourable gentleman is right to raise this. This is a concern. It was a concern in making this decision. I think I set out, how I have taken that into account, but I can give him the assurance that this will be monitored on a day-by-day basis by our colleagues in NHS England, of course, the department itself, and whatever workforce planning is necessary around this will be done.
Matt Hancock.
Thank you very much, Mr. Deputy Speaker. Can I warmly welcome this decision from the Secretary of State and warmly welcome the cross-party consensus that there is behind it. Medicine is based on science, and the vaccine is the best of science, and we should use all the science and all the tools at our disposal to keep people safe. So I think that is the justification for this policy. I also support the extension of this to flu in due course, and I'm glad that the Secretary of State is keeping that open. I would urge him to continue to push on that as soon as is practicable. But could I also invite him to join me in saying that since there is a cross-party consensus, and since this announcement has now been made, this is clearly going to happen, and therefore all those working in the NHS, including those who have so far been hesitant, should come forward as soon as possible to get these vaccines, because they're going to have to get them, so better to get them sooner rather than later.
Yes, Mr. Speaker, I agree wholeheartedly with my right honourable friend, and can I also just take this opportunity to thank him again for the work that he has done in government and particularly in this department in laying the foundations of our successful vaccination programme. Without those foundations, we would not have been able to take this positive step today. And he's absolutely right to point to the fact that vaccines work, they are safe and effective. Public Health England estimates some 230,000 hospitalizations at least have been prevented, and over 100,000 deaths have been prevented. And he's also right to say that now the government has made this decision, and subject to the will of Parliament, this will happen, then that is an opportunity already from this moment for people to make this positive choice. And in doing so, we will help those people in every way that we can.
Clive Effort.
Thank you, Mr. Deputy Speaker. I welcome the Secretary of State's announcement today, but if this is about minimising transmission, then surely it follows that we should be reviewing the guidance on facial protection and FFP3 masks. Right. So will the Secretary of State be following the recommendations of the Royal Colleges and Trade Unions that staff in care homes and in the NHS who are frontline staff should be issued with FFP3 masks?
Mm-hmm. Secretary of State.
Well, Mr. Deputy Speaker, the honourable gentleman will know that masks play an important role in vulnerable settings, in health care settings and social care already. And he's pointed to a specific suggestion by some that that maybe the requirements around masks, the type of mask should be changed. And I'd like to reassure him that this is something that we keep under review at all times. And if that's necessary, it's something we would support.
Sir Edward Lee.
It's obvious that the booster jab is absolutely essential to protect the very vulnerable. Now, I have an elderly family member. He's 90 years old. He's completely bedbound. He's living at home. He can't get out of the flat down the steps. He's been waiting for weeks for his booster jab. He said to me on Sunday, "Where is my booster jab?" Now, I suspect that across the country, it's just quite inconvenient to get out these very elderly people who are living at home. They're not in care homes, they're at their own home. And they're being looked after all day by care workers coming in and out. So will the Secretary of State now give an instruction to health authorities, GPs, district nurses, get out and get these booster jabs in these very old and vulnerable people?
Mr. Deputy Speaker, can I say to my right honourable friend that what he has just said deeply concerns me, because anyone that is, I think they're 90 years old, they are homebound, they should, certainly at that age, should have been contacted. I'm assuming that there's been at least 6 months since the individual that he mentioned, since the second jab. And on that basis, he should have been contacted by his GP, and because the GP should make a visit. So I would like, first of all, I would like more details, if he may supply me, of that particular case. But also, I would just want to then go back and make sure that there are no other instances like that, because certainly someone at that age and being homebound should already have received their booster jab.
Kirsten Oswald.
Thank you, Mr. Deputy Speaker, and thanks to the Secretary of State for setting out his thinking today. The government said in its budget that it planned to invest responsibly. Does the Secretary of State believe that it was responsible to cancel a multi-million-pound contract to supply a COVID vaccine that phase 3 trials show may be more effective than the Oxford vaccine, threatening hundreds of jobs in Livingston for no apparently good reason? And will he consider rethinking that unfortunate decision?
Secretary of State.
Mr. Deputy Speaker, I think I know the case the honourable lady is referring to, and we are very clear in our decision, and it was made for all the right reasons. I'm not at liberty at this point to share those reasons. There's commercial and legal sensitivities. I hope she will understand that, but I can assure her there is absolutely no point in revisiting that decision.
Mark Harper.
Mr. Deputy Speaker, can I welcome what the Secretary of State has said about his proposed method of dealing with this issue in Parliament, and his confirmation that he's going to publish an impact assessment ahead of the decision. That, of course, was not what happened when we voted on the care home vaccination issue, for which, to be fair to him, he was not responsible. That decision and the way it was conducted was an abuse of this House, asking us to vote on something. And I think he's just confirmed that of the 40,000 care home staff that the government estimated were going to leave the care home sector because they hadn't been vaccinated, I think he just confirmed that 32,000 of them, 2 days away from the deadline, remain unvaccinated, which is a very significant number. So can I just ask him, when he publishes all the information for us before we make a decision, can he make sure, as well as the impact assessment, it includes a plan to deal with what sounds like will be something like tens of thousands of NHS staff who, if the care home workforce is any precedent, are going to end up leaving the National Health Service? Now, that may be the right decision, but we have to have a plan to deal with it. Not having had a plan for the care home sector is causing enormous pressure, not just on the care home sector, but on the NHS. And I want to make sure when members are asked to make a decision, we have all the information at our disposal so we can make the best possible decision in all the circumstances.
Mr. Deputy Speaker, can I thank the comments from my right honourable friend? And he's absolutely right. Parliamentary procedure, of course, is vitally important, as well as the impact assessment before vote. I can also share with the House we will be publishing an impact statement today, followed by the impact assessment later. And the 32,000 number he's referred to, I would just point out that was the latest number that we had at the end. It's a published number at the end of last month. And although it's only been a few days since then, it is quite fast moving at the moment, because it might include a number of people, perhaps in their thousands, that are medically exempt. And we haven't been, or CQC hasn't yet been informed of that. But he's pointed to the need for the government to share its thinking, or NHS's thinking, with respect to this new measure on workforce planning. And we will set out more details.
Daisy Cooper.
Thank you, Mr Deputy Speaker. A number of care home owners have said that the damage is already starting to be done, and they're seeing some of their carers either leave their jobs or leave the sector entirely. I welcome the Secretary of State's statement that an impact assessment will be forthcoming, and I look forward to seeing the impact statement later today. But he also mentioned in response to the Honourable Member from Rochdale that his department is monitoring this on a day-by-day basis. I worry that an impact statement might be too late if we have to wait 2 or 3 months for a vote. So will he commit to publishing that data that he's looking at day by day, so that members of this House can see in real time whether or not this policy is going to have an impact on the workforce situation in the NHS and in care homes?
Tuesday.
Mr Deputy Speaker, just to share with the Honourable Lady that we will be publishing the impact statement today.
Tim Lawton.
Mr Deputy Speaker, whilst I want to see everybody vaccinated, I don't support mandatory medical interventions, and I worry for the impact on the already high vacancy rate within the workforce. He must have done some risk assessments, so can he answer me this? How many of those 10% unjabbed does he assess, as previously asked, will be subject to medical exemptions? What calculations has he made of the likely job losses overall? When will he publish a list of exactly what personnel are involved? Would it involve cleaners, for example, who don't have medical engagement with patients, but are certainly in proximity to them? And when will he publish the evidence and the data for the number of patients who have been infected by COVID when in hospital from unvaccinated staff?
Mr Deputy Speaker, I hope my honourable friend appreciates there's a lot of questions there, and many of those there will be the impact statement today, also the impact assessment before my honourable friend and other honourable members are asked to vote, and they will help to answer the questions. But I also would just draw his attention to the experience thus far of the measure, the condition of deployment measure that we took in a similar way with care homes, and the numbers I mentioned earlier, and how dramatically that they were cut from the point of announcement.
Smith.
Deputy Speaker, of course NHS and care staff should all be vaccinated. That's what we expect for our loved ones, and of course they should all be wearing masks, and the Prime Minister parading around a hospital yesterday without a mask is a disgrace, and I hope the Health Secretary is talking to him about that. But I support the questions about more detail in the impact assessments from other honourable members, because in Bristol I want to know, are those 10% in Bristol? Is it 20%? Is it 30%? Is it 2%? If the Health Secretary knows that information, then I, as a Member of Parliament for Bristol, should know that information. And secondly, if all staff and associated people in healthcare settings are to be vaccinated, will there be a COVID passport for people to visit hospital and care settings?
Crusade.
Mr Deputy Speaker, I mean, first of all, can I just gently say to the lady that she really shouldn't try to play politics about this story that she's perpetuating about the Prime Minister yesterday in a hospital visit. As the Hospital Trust said itself, and I'm sure the Honourable Lady knows, the Prime Minister and his team followed all rules that were required, whether it's face masks or otherwise, in every setting in that hospital that was necessary and they were asked to do. And I think something tells me, Mr Deputy Speaker, the Honourable Lady knows that, but she's decided, sadly, that she wants to play politics with such an important issue. As for Bristol and information on vaccination rates, she will know that every region of England has a public health director, a director of public health. She probably knows who hers is for that region, and they will be able to supply a lot of information. If she is having any difficulty in getting the information, I will certainly help her in any way that I can.
Dr. Andrew Morrison.
In my interest as a vaccinator, I support the government's position on this. But will he say what assessment he has made of the risk of transmitting coronavirus from an apparently healthy person to a vulnerable person, since as with hepatitis B, the only justification for this must be that there is a significant risk of transmission? Will he furthermore reassess his position on flu, following the comments of his two predecessors, which I support? And will he ensure that we do nothing to trespass on the rights of individuals unless it is absolutely essential to keep vulnerable people safe? Finally, would he say why he has gone for the 1st of April? Since if this has to be done, then it is better to do it quickly. And by the spring, clearly, we're going to be past the winter pressures that we're all concerned about.
Mr. Deputy Speaker, first of all, can I thank my honourable friend for his support. On the assessments that we've done, I've shared some information with the House, and as I say, there will be an impact statement followed by an impact assessment that will give my honourable friend more information. It might be helpful for him to know that already what's in the public domain, we know that against the Delta virus, that studies show that if you have taken an AstraZeneca vaccine, you're 65% effective in preventing infection. Pfizer vaccine is 80% effective in preventing infection. And of course, the fewer people that there are infected in these settings, the less spread there would be. On flu, I think I've set out the thinking of the government, but it is something, as I've said, that remains under review. And the reason that we have focused on the 1st of April date is there's lots of reasons, but the main one I would say is to really give an opportunity to those as yet, so 100,000 or so in the NHS that have not had a single jab to make the positive decision to get vaccinated.
Rachel Maskell.
Thank you, Mr. Deputy Speaker. In York, vaccination rates are high at 87%, but also transmission rates of COVID are extremely high as well. And transmission is happening in the community. And as a result of that, Directors of Public Health like my own are absolutely despairing that the Secretary of State and others in his department are not listening to those public health experts which are asking for the tools to be restored to manage the virus. So that's contact tracing immediately into local authorities where they got on top of the virus and locked it down, and also to ensure greater public health measures are taken. Hands, face, space needs restoring in all settings.
Mr. Speaker, first of all, the Honourable Lady, I think she's right to point to the high vaccination rates in York, and that's to be commended to everyone involved. And when it comes to other measures that may or may not be taken, I think the approach the government set out, the sort of Plan A approach, is the right approach. There may be reasons in certain regional areas to take a slightly different approach, and if that happens, that is also possible with the right evidence, but it's something that we always keep under review.
Jim Shannon.
Thank you, Mr. Deputy Speaker. Can I thank the Minister for his clear commitment and for addressing and regular updates we get here as well. Is the Secretary of State able to provide an assessment with regards to the availability of the new COVID drug, molnupiravir? And if people get that pill within 5 days of symptoms, they cut hospitalisation and they also cut death by 50%. So, Secretary of State, will it be available across all of the United Kingdom? And whether the vulnerable classification will include the diabetic and the immunosuppressed?
I can tell the honourable gentleman that the drug he's referring to, the antiviral, that one has been approved by the MHRA, and we do have that drug, and we have, since the point of approval, which was last week, have already started deploying across the United Kingdom. There is also another drug, another antiviral that we have put an order in for, but as of yet it's had very successful trial outcomes, but it has not received any final approval. And we are hopeful, if the MHRA independently decides to give it approval, of course that's a decision for the MHRA, then I think the country's in a fortunate position that we have procured that drug too.
Barron.
Thank you very much, Mr. Deputy Speaker. One of the major objectives behind the successful vaccine programme is obviously to reduce infections, reduce hospitalisation, allow health professionals to focus on other even more dangerous conditions, including, of course, cancer. He'll be aware that in 2020 there were 35,000 missed cancer diagnoses, that the LSE study shows 60,000 potential lost years of life to cancer as a consequence of COVID, and that it's estimated it will take the NHS's diagnostic and treatment services 120% working at 120% capacity for 2 solid years just to get back to March 2020 levels. He, I suspect, will be as disappointed as I was that there was nothing new in the budget to help us to catch up with cancer. So I wonder whether he would follow his own good example, his government's own good example on the vaccine rollout, and adopt the same relentless focus on catching up with cancer, with targeted resources and leadership. And would he agree to meet with clinicians and the cross-party catch-up with cancer groups so we can work together to save those tens of thousands of lives that would be unnecessarily lost otherwise?
Mistake.
Mr. Deputy Speaker, I think the honourable gentleman is absolutely right to raise the importance of cancer. And for all the reasons he said and more, it has remained an absolute priority of the government and the NHS throughout the pandemic, despite the huge pressure the NHS was under. And sadly, he's also right that, and I've talked to this just as he has, that there were many thousands of people that were undiagnosed because of they were asked to stay away from the NHS to protect it. We all understand why that happened, but sadly, there was a consequence, unintended consequence of that. He's not right, though, to suggest there was nothing in the budget or the spending round that came out with the budget to help with this. So what I would draw his attention to, for example, is the billions of investment in the new community diagnostic centres, over 100 across England, that will mean that it will be much easier for GPs or others to refer people with suspected cancer for diagnosis much more quickly. There are other examples, but I hope he's reassured that this remains an absolute priority.
I'd like to thank the Secretary of State Health for his statement today and responding to questions for over 40 minutes. Point of order, Dame Dara Johnson.
Thank you, Mr. Deputy Speaker. Mr. Deputy Speaker, you will be aware of the importance across the country, not least in the north of England, of the long-awaited integrated rail plan. And in Hull, we await news on the government's levelling up promises around rail electrification and the eastern leg of HS2. But recent reports suggest that the plan may be published this week on the 11th of November. And in transport questions on the 4th of November, the Minister of State for Transport, the Honourable Member for Pendle, said, "I am delighted to say that the integrated rail plan is not just coming soon, it is now coming very soon." And this evening, the House goes into recess until next Monday. Mr. Speaker has repeatedly reminded ministers of the need to make important policy announcements to this House first. And I therefore ask Mr. Deputy Speaker whether Mr. Speaker has received notice of any intention by ministers to make a statement in the House regarding the integrated rail plan, and whether Mr. Speaker has sought any assurances that such an important statement will not be published while the House is not sitting.
I'd like to thank the Right Honourable Lady for her point of order and the forward notice of it. I've certainly not been given any indication that any statements are going to be made other than the one that we have just had. But she has made her point very well, and Mr. Speaker has made his views clearly known. And whenever that report is published, I hope there's going to be ample time for Parliament first to question ministers on the contents of that report.